For the first time in a generation, measles is spreading across the United States. So we know many of you are concerned about this outbreak. As of this month, the CDC reports more than 1,300 measles cases across 40 states since the start of the year.
And just this week, another confirmed measles case was reported on the Western Slope. Plus, there's been a possible measles exposure at Denver International Airport, happening on August 12th.
And all of this is happening as kids are headed back to school. So Denver7's Colette Bordelon takes a 360 look at this highly contagious and preventable disease, exploring thoughts about the vaccine, including why some people are questioning it.
This Colorado city has a reputation.
Boulder is its own little place, right?
It's where you'll find mindful pediatrics.
I have kind of like a traditional Western practice, but I practice holistically, so I use a lot of natural medicine as well.
Dr. Roy Steinbach says about 3 years ago, he closed his primary care practice and now consults on what he calls complex cases.
The clientele that I have is generally very conscious. They're people who are super highly educated typically and are following what's going on in the news, and of course a lot of them are unvaccinated, so many of them are getting scared with the fact that there is this sort of uptake, at least in the media, where there's a lot of attention towards the measles outbreak.
Steinbach says it's a daily conversation with his patients. Parents either making sure their children are up to date with their vaccines or deciding if they should vaccinate their kids against measles.
As a general rule right now, I would recommend getting it for most people. But if someone's really dealing with a health issue, I might consider postponing it a little bit.
He's open to creating individualized vaccine plans.
I always joke, I'm like dogmatically non-dogmatic. I'm not a black and white person. How could I know something for certain? I use the best of my intellect and my experience and all of that to try to, guide my patients. It's also not my job to judge them or to tell them what to do.
You have kids.
I do.
Are they vaccinated against measles?
Yeah, my kids are all up to date on their vaccines.
Are there risks that you weigh with vaccines?
There are, but the problem with that is it's pretty unknown what those real risks are. And I think that's what makes people crazy, right?
The fact that we have the ability to prevent infections is such an amazing thing. And the fact that we're not utilizing those tools because of fear and anxiety is actually very unfortunate.
This is Dr. Michelle Barron, the Senior Director of Infection Prevention at UC Health.
Measles. Oh, hot topic. This is the biggest outbreak we've seen in the last 25 years.
The first written account of measles dates back to the 9th century. And the CDC reports that by 1912, healthcare providers and labs in the U.S. were required to report all diagnosed cases. In that first decade of reporting, roughly 6,000 measles cases were recorded every year. In 1963, a vaccine was licensed in the United States. And by 2000, measles was declared eliminated from the country. That's attributed in part to the vaccine program.
MMR is measles, mumps, rubella, and then sometimes V is varicella or chickenpox would be included in that as a potential vaccine. It includes pieces of the virus that your immune system can then identify and say, that's my target. Really, there is no concerns from my end in terms of offering this vaccine. It's been around for 60-something years. It's very safe and it's highly effective.
Data collected in Colorado over the last decade shows a dramatic spike in measles cases with over 20 this year alone. That's more than we've seen in the past 10 years combined.
At this point, the chances of getting measles is low, but that could change. It already is changing. The fact we're having this conversation at all is because things have changed.
The state reports that 2 doses of the MMR vaccine are 97% effective against measles. Immunization data by school district is tracked by the Colorado Department of Public Health and Environment. Last school year, for the MMR vaccine, most of the state is covered in green, indicating at least 90% of the district is vaccinated against measles.
Anywhere where the vaccination rate is under 95% means that they're at potential risk.
Several of those pockets are clustered in and around Colorado Springs, along with the southwestern portion of the state.
One person with measles has the potential to infect 17 people. It can stay in the air for up to 2 hours. You don't even have to be in the same space at the same time. You could have potentially been in the grocery line with somebody who measles, who coughed or sneezed, and then 2 hours later, you come in to check out, it's still in the air potentially, and that's how you get infected.
Have you seen any trends around vaccine hesitancy since the pandemic?
Yes, definitely has increased in the last 5 years.
Reasons for vaccine hesitancy might change over time. I think the vaccine hesitant groups might change over time, but vaccine hesitancy is not new.
The state epidemiologist, Dr. Rachel Herlihy, says Colorado has struggled to meet the 95% measles immunization threshold that she'd like to see.
We've been fortunate, but we know there is risk here, especially in those pockets of under-vaccination.
And vaccines are a topic that's dominated the headlines in the past few years.
If the pandemic hadn't happened, then vaccines probably wouldn't be on my radar the way they are now.
Ethan Augreen says the pandemic played a role in the perception of public health in the country.
I studied herbalism in New Mexico and also here in Colorado, and so I've had kind of a basic understanding of natural health, and I just trust that more than the pharmaceutical industry.
And a certain cause.
It's like MAGA, but with an H.
Captured what he believes.
Well, Robert F. Kennedy Jr., I supported his campaign for the presidency, and when he dropped out and threw his support to Trump, I was disappointed, but also decided to trust his judgment.
Augreen says that decision was not directly connected to a political party affiliation.
In the past, we definitely thought of more as people who were left-leaning, farther left-leaning, were more inclined to be hesitant around traditional medicine and be more skeptical around vaccines generally.
Social psychology, in particular, when it comes to politics and decision-making, is Danny Grant's specialty.
It has been an interesting shift in the last few years.
She's a PhD candidate at CU Boulder.
People now on the far right are also leaning more into like the holistic medicine, the like kind of pure life philosophy that we would traditionally think of as like the far left that tends to reject or at least be very hesitant engaging with traditional medicine, in particular with vaccines.
It's something she wouldn't have expected before becoming a social psychologist.
We tend to assume that there's a lot more different between us than there actually is.
A cultural phenomenon playing out in public health.
Having civil discourse is never a bad thing, and I think people sometimes take that as a meaning of, oh, you all don't know what you're doing. To say that we know everything would be incorrect. We do not know everything. There are things we have yet to discover, and we evolve. But to say that all science is junk is also incorrect.
And the experts we met encourage asking questions. It's what they do best.
A lot of people take their very type A personalities and they put that on health, which I don't always think is the healthiest thing to do. It can make you very stressed and worried and neurotic about things.
We need to understand what the person is questioning, and then we can answer that.
Hoping a conversation with different opinions is the start to understanding each other. Colette Bordelon, Denver7. So if you or someone you know is one of the Coloradans who've had measles this year, Colette's interested in sharing your story. You can reach out to her now. Just scan the QR code on your screen or send Colette an email at that address you see there.